Good evening. My name is Irene Ringfield. I live in the state of Georgia. I'm originally from Ghana, West Africa. I've been a nurse for 13 years. I've mostly done labor and delivery and women's health, basically mother, baby, labor and delivery currently for the past 9 years. I have not had any primary care experience apart from the ones I did during these clinical rotations, and I seem to enjoy them a lot. After graduation, I hope I find employment with an outpatient primary care setting. About how I came to find Regis, I sought to go back to school a couple of years ago and looked at a couple of schools online, and someone just happened to send me emails and text messages from Regis, and I followed up and I looked into it. It was a Catholic school and I grew up as a Catholic, so I just went there based on the Catholic background. About the generalized patterns of nursing care that are represented in the circle of care models, I believe that the role of the advanced nurse practitioner is geared towards combining nursing care with medicine. In doing so, the provider is able to provide holistic care, which takes care of the person as a whole. That is the spiritual, the emotional, and the physical needs of the patient. Nurses are naturally nurturing. We take good care of patients. We care for patients in all these aspects, the spiritual, emotional, and the physical. And the advanced practice incorporates the medicinal intervention into the practice. By incorporating the circle of care models into my practice, I will be able to see my patients as good humans who are worthy of my respect, my attention, and my care. The two patterns that I would like to especially adapt in my practice are the authentic presence and patience. I just don't want to be there for my patient like many doctors do, asking how the patient is doing and looking elsewhere, or maybe looking at their text messaging, right, and then tell them what's going on, and then just tell them, oh, I'll send so and so medicine to the pharmacy for you. With advanced practice nurses, it's different. We incorporate our nursing, the nurturing care that we've been taught, the background that we have, the things we've always done to our patients, taking time to listen to them, to care for them, and being there for them, and then incorporating the medicinal diagnosing, medicinal intervention in their care. I want to be there for my patients. Authentic presence, in my little understanding, is being there wholeheartedly, like with your whole being, and the patients can connect. I'm a labor and delivery nurse, and when you are there for the patient, you can see that you can see the patient through the patient, what her emotions are, what her fears are, what her anxiety level is, and all that, and you're able to help. I just don't want to be there for my patient. I want to have the authentic present. I want to be there as a whole person, knowing myself, seeing the patient through him or her, and knowing what they are going through. And we are spiritual beings. If the patients realize that you are there authentically, they open up for you, and they are able to connect with you better. And the other thing I want to also exhibit as an advanced practice nurse in caring for my patients is patience. I want to be enduring. I want to be involved, do patient-centered care. cheer my patients on in making their own decisions, be patient as they make their own authentic and autonomous decision about their care. I want to honor their decisions. I want to stay back and honor how they want to be cared for and just do it for them. I want to educate my patients, acknowledge their autonomy, and by doing that, just lay back and let the patient take charge. And that's patience. Every healthcare provider needs to be patient with their patients because they come with a lot of anxiety and fear. So when you give them the patience and let them take charge and take over, you are even better off taking care of them. Thank you.